Hi, I'm Dr. Rajani. This is a cool one. I'm reacting to Refinery 29. A patient goes in, gets a PDO thread lift. She talks before the procedure. We get to see her after with the threads finished, see what she looks like. She describes the appearance, and a plastic surgeon does the procedure, and we get to hear some of what she thinks about as she's doing the procedure, what goes through her mind, and a consult. This is the first time I'll have been watching this video. Let's dive in.
Hi, I'm Rachel, and I'm here getting a suture suspension lift today. I'm a mom of 2 kids, and I work full-time. I spend most of my days on Zoom calls staring at my face. And I think over the past year, I've learned that I'm more resilient than I thought I was. I'm more positive. I have a better sense of humor. But when I was looking at myself on those Zoom calls, I didn't see that person anymore. I'm really excited to look like myself again and to feel like myself again.
Hi, I'm Dr. Lara.
How commonly do we hear that? And she looks like a great candidate for it. She doesn't have a lot of loose skin, and she already has a great attitude, but too much loose skin would take her off the map for being a good candidate. And how about that Zoom? That kills us all, even me right now.
I'm Dr. Lara Devkin, and I'm a board-certified plastic surgeon in New York City, and I specialize in facial optimization. Facial optimization is the combination of surgical and non-surgical procedures that I use to optimize facial beauty while preserving facial identity. Tell me a little bit about what you're hoping to get out of this.
What I'm noticing in my face is that my laugh lines have become very deep.
This is the malar fat powder, the apple of the cheek, and when you're 25, it's right here. And over time, it comes down a little bit. So you're getting a little bit of mid-face flattening. We'll do a couple of little tweaks here and there. I think it's gonna be awesome.
So you see, that's still the #1 driver to our practices, nasolabial folds. She needs a little bit of tweaking. She doesn't want to have surgery. Surgery is a big operation, and of course it produces the most scar tissue of all the procedures we could do, and a lot of them are visible. So great candidate so far. And then I love what our surgeon said. Just going to refine things, just going to do some tweakments, what people want.
Suture suspension is a modern technique that allows us to lift the deep planes of the face using a tiny little needle access site and dissolvable surgical stitches.
So you heard that. The word lift is important. They don't bloat the face. Lifting is what people are after.
I have had Botox in the past, and I have had a little bit of filler in my cheeks, and both times I loved the effect. My only fear with having this procedure is that I'm gonna love it.
Okay, a couple of things to unpack here, 3 in fact. #1, you have a plastic surgeon doing the treatment. How many times a year? Plastic surgeons don't believe in them. Plastic surgeons don't do them. In fact, one of the best studies recently done was by a New York plastic surgeon on threads, the safety of them, and he was an advocate for them. So that's the first thing. Second thing, she had prior Botox and fillers. How many times do you hear or do you ask me, hey, can I have threads? Can I have a facelift if I've had fillers, biostimulators, prior Botox? There's a lot of fear mongering that, hey, you cannot get a facelift if you've had fillers before, if you've had threads before. Obviously, that's not true. #3, you're seeing, what did she say? The only thing I'm concerned about is that I might want more treatments. This is the trend. People want to come in more and more often to clinics and medical spas, and many plastic surgeons' offices provide threads, provide biostimulators, provide Botox. She'll likely, down the road, maybe one day want a facelift. She can still get it. And having prior procedures doesn't mean that she can't get procedures down the road, including surgical ones. 3 very important points there. Let's move on.
We'll use injected numbing medicine to make sure that the patient feels comfortable. And that's really the only part of the procedure that hurts a little bit. It feels like a little bee sting for about 10 seconds.
In control, there's a lot of uncertainty here. She's using numbing lidocaine at the opening. Now you can also put lidocaine down the cannula and kind of to mess it, what we say, and that's where we put a little lidocaine as we go to make the whole area numb as well. Understand, technique is key and each person is specific. So how someone places it, the depth, how gentle they are, maybe how good their hands are, will determine the pain. Some people have a bad experience and some people have better experiences, and pain is individual. We never know when people come in, are they going to have a high pain tolerance or not? And so we adjust. A great practitioner is going to adjust kind of figure out what that patient really needs for pain control, and then can get you there. But they do not need to be painful at all.
The first step is to make a tiny access hole and a pilot hole using a little needle prick that's hidden right in the sideburn area.
So I always like to work from the back of the face. This is an 18 gauge needle that she's using. A lot of people will ask me, hey, does that leave a scar? No, it's like a blood draw. Does your blood draw leave a scar? No, very small. And everything from the back of the face is always better.
Next, I'll use sterile cannulae, which are basically stainless steel surgical tiny little tubes, like thinner than a coffee straw. And those will be inserted into the tissue in the deep plane. So the deep plane of the face is the deep muscular layer that I actually will lift in a surgical facelift. The amazing thing about the modern generation of suture suspensions is that I'm able to access the deep plane of the face through a tiny little needle hole.
You always hear deep plane, like from a deep plane facelift. And so it's important, you have to have the right
So once
plane.
I insert the cannulae, those will deliver barbed suture suspensions. And the sutures that are being placed are made out of a dissolvable material that's a complex sugar molecule. It stays in the tissues for about a year until it fully dissolves. And in that time, it also causes the body to stimulate collagen production.
Okay, so key to know, they're dissolvable sutures, they're not permanent. Now there's PDO, polydioxanone, the most common. PCL, polycaprolactone, and PLLA, like Sculptra, poly-L-lactic acid. Those are all dissolvable, different materials. PDO is the most commonly used because it's a sweet spot for longevity, yet decreased side effects. And if there is something, they don't last too long. Now here's the thing. When you get your threads, you're going to say, well, how do I know what I'm getting? You don't. But if you ask your provider, can I see the package? What type of threads are you using? Where are they made? I think that's very okay. I don't think you have to feel embarrassed by it. I don't think you're offending anyone, at least not for me. I tell my patients, ask me whatever you want. You need to be comfortable. Now, people can buy their threads off Amazon. People can buy their threads in different countries. I don't think that's good. Mine, I buy, they're made in the USA and they're fresh. One of the things that happens over time, if people aren't using the threads, especially if the packaging is bad, oxygen and moisture get in. And if you take one of those threads in your hand, pull it, it breaks. So the thread lift will be no good because the thread has lost its integrity. So much goes into the thread lift. You've heard about the plane of injection, so where it is in the skin, you need to have the right thread. So when someone says, my thread lift failed, understand what all goes into this to make it successful. The type of threads are key, and you should know, in my opinion, what's going into your face. No one's going to be offended if you ask. So these look like Nova threads. It almost look like what we call molded threads, but likely the way the cannula looked for engaging it, it was a barbed thread, but it looked molded. There's different designs of the threads, and those are very good threads she's using, so I would expect a great result. You can't go to someone who's not using the right type of threads, or how could you possibly get the right lift?
Once the sutures are placed, I double check the vectors, so they can be placed in many different orientations depending on the patient and their goals and anatomy. I'll suspend the sutures, I'll tighten them.
Let's talk about this part for a minute. She's tying the sutures. She's a surgeon. Look at her gloves. They're sterile gloves. Now, I think most people shouldn't tie sutures because they're in a med spa environment, they're using non-sterile gloves, tying the knot, and then the knot goes where? Into the body, under the skin. Sterility of what's in our body is key, just like the material of the sutures used. So when I see people tying them, for her, it's great. I agree, and I like exactly what she's doing. It's good. But for the majority of people that don't have sterile instruments or sterile gloves in their clinic, and I see them tying things up, the hair's in there, it's hardly cleansed, and then they bury that suture, what happens? They call back with a nodule. Now you have maybe an infectious nodule, maybe a nodule from the suture itself because there's a knot under the skin. And there are devices now that we have that we can undermine the area, so underneath the skin create a space so that that tied suture, that knot, is hidden underneath. But most people don't even have that device in their clinic. They're just tying, oh, I'm gonna tie it off and put it in. I think that that ends up being a disaster, and what are you tying it to? Again, she's doing a great job and she has everything in practice, obviously, to do this. The majority of people do not.
Trim them, and then I'll re-drape the patient's soft tissues with respect to the deep plane of their face.
Now she's setting the threads by moving the skin and those deep tissues over those barbs. Again, those are 18 gauge.
You might hear a little bit of clicking because some of the suture suspension gets transmitted through bony hearing conduction into the ear canal.
It is kind of weird when you hear it, when you're getting them done to yourself. I've had them. And then you see that pull. Okay, so we can clearly see those are barbs, they're not molded. So I was
And
wrong.
then finally, the patient will sit up, I'll take a look at everything in the mirror, and we'll do little adjustments to build structure with injectables, in addition to the lift that we created with the procedure.
So that's Botox, Dysport, something like that in the glabella. Combinations are best, always.
So, looking really beautiful. You want to take a look?
Yes.
The money time right here. Let's see.
Oh my God. Oh my God. I was absolutely blown away. When I first saw myself, it was like looking in a mirror from 10 years ago. I look like myself again. I love how uplifted my face looks. My eyes are brighter. I feel so great.
I'm so glad you're happy.
I'm
you
obsessed.
look
I can't
so
put this mirror
beautiful
down.
and refreshed. So what we did was give you a lift of the mid-face and definition of the jawline to pick up the jowl. And we have a highlight on the cheekbone, a low light in the cheek sulcus shadow. And then right here is an almost textbook gonial angle, or angle of the mandible. That's looking very beautiful.
I expected the treatment to be painful. You know, the surgery does involve barbs going into your face, which sounds really painful. And the biggest surprise for me was that it really wasn't. It looks amazing. I don't think anyone would know that I had had something done. They would just say I look great.
Yeah, and that's the idea.
So that's what people want. Okay, so the 99.99999 and on % of people don't want surgery or they can't afford it. It's now $50,000 to $150,000. It's for the elite. There's no fillers, no bloating of the face. Great. Hear what she said. Other people would notice. You just look refreshed. She would be very happy with that result. What would it cost? So that's about $2,500. How often do you need to repeat it? Do you see how she did some Botox, Dysport, Xeomin, something in the glabella, so you can do your Botox with it? I would add a little bit of Sculptra often. I'd add PRF under the eyes, some different things. And in general, $2,500 to $4,000 to $5,000 every couple of years. That's a good way to think of for the majority of people. You will still do your skin therapies, your microneedling, great skincare. You have to be on great skincare, your sunscreen, exercise, nutrition. All those things make it last longer. So when people say you got to repeat every 6-8 months, it's not true. And when you repeat them, you need them less often. That's the beauty of it. So if I do 12 to 15 threads per session in a session, 18 months later, I might be adding half of that because the Sculptra's still working. The PRF I might redo, might do a little bit of Botox. So you're just maintaining, and the key is you don't need a big surgical procedure. Look at her, almost no downtime. Smiling, moving, ready to go, no bruising. So I know there's a lot of fun. I know a lot of people say, well, plastic surgeons don't do them. They get scar tissue. You can't do facelift afterwards. All those things I talk about on this channel, I could have put a complete video up here on thread lifts, one down here on things you can do at home. Keep your skin and body beautiful, healthy, and vibrant.